Hi, my name is Stephanie Ross. I'm a physical therapist at DPU Health System.
My name's Hayden Smith. I'm also a physical therapist at VCU Health.
And we have Ann with us today.
Ann, you mind if we tell them a little bit about you? So Ann was diagnosed with Parkinson's initially 5 to 6 years ago, which was then eventually transitioned to a diagnosis of PSP and has since been transitioned to a diagnosis of corticobasal syndrome. So she kind of flips the lines between all of those atypical Parkinsonisms. I've worked with her since I was a student therapist, and now she continues to see us here at VCU. So we're gonna, Ann graciously volunteered to be a patient example and help us show you guys some tips and tricks for safe handling techniques, mobility, and then some exercises as well.
So we're going to start with sit-to-stand. And the basic steps for sit-to-stand, what we recommend is always have the patient scoot forward, get their feet underneath of them, and then lean forward and do a weight shift forward up to full extension. When you're assisting somebody, we want to always make sure that you're using your legs when you're assisting somebody. We recommend caregivers to use gait belts as well. You can get them on Amazon. And when you do this, you also want to make sure your core is nice and tight, so that'll help while you're engaging your core, you're using your legs as well. And Hayden and Ann will demonstrate that for the sit-to-stand. The other piece, whenever you're assisting anybody with transfers in and out of bed, sit-to-stand, we do not recommend pulling on someone's arms because you can't hurt their shoulders.
So one of Ann's home exercises to do with her caregivers, which she has a great team of caregivers, is to work on these sit-to-stands where we're really facilitating the forward weight shift in the way that Stephanie was talking about by having Ann actually press her head into my shoulder. So Ann, you'll lean forward into my shoulder on the count of 3. Stand up. Ready? 1, 2, push your head, and 3. So we get way far forward, weight through the toes, and then squeeze your butt and stand up nice and tall.
Notice Hayden also is weight shifting. That helps create momentum and then help elicit that initiation for the anterior weight shift or the weight shift forward.
And all the way up, Ann. Looking up over my head. There you go. So this is actually very good upright posture for Miss Ann. She sees a chiropractor for some of her neck difficulties. She was having a lot of neck pain, and dry needling to her neck has actually helped a lot recently with that pain, as well as her drop head posture. So Ann, if we're going to sit down, you're going to lean your head forward into my shoulder again, right? There we go, and then stick your butt back. So if we were going to do that as a transfer rather than a home exercise practice, it would be the same thing, just without me sitting down. So Ann, we're going to come sit on the edge of the bed here now. Same thing, pushing your head into my shoulders. So caregivers, you want to sit your hips down as low as possible with your chest up. And you want to almost rock your weight back rather than up. It helps you have good body mechanics and avoid lifting with your back. So then we're going to do a little dance and step over here. So follow my feet. Good.
As Hayden's weight shifting, and it helps Ann initiate the weight shift, which will initiate the stepping.
The visual cues of watching my feet move also help her a lot with knowing when to step and which way to step. That's great, Ann.
All right. The next one we're going to do is lie down. Yeah. Okay. So when you're assisting somebody with lying down and sitting up, you want to kind of create that pivot point. So we usually recommend from sitting to lying down, typically bringing head down first. And let's go ahead and bring your head down over to the toes on the left, okay? You can come onto your elbows there. Doing okay? Okay. And then she helps, yep, and then she's bringing her leg. Come down onto that elbow. There you go, that pivot points your hips, right? Good. There's two pillars, is that good, Ian? Perfect. Nice. Okay. And then let's go ahead and roll onto your back. Are you able to lift your bottom up? Scoot over to the left side a little bit. I'm going to bring them up a little bit. How you doing? Can you scoot a little bit more over to that left side? There you go. And sometimes if someone's having a hard time scooting, having a flat sheet horizontal to the bed is a nice way to help assist somebody with scooting left or right and not shearing skin. All right, I'm going to assist your shoulders over. Is that okay? Okay. All right. There you go. Kind of helps just a little bit. All right, and then let's go ahead and lift your bottom up. So to help with someone's bottom up, having them in a bridge position, and then just shifting. And then let's scoot on over to the left a little bit more. There you go. How do you feel? Good? Okay. All right, some priming things that you can do to help maybe prepare yourself for getting out of bed is doing some rotation exercises. Okay? You do it sometimes in the morning before you get up and out of bed? Yeah. Right? Because you've been sleeping all night and you get a little stiff, right? Okay. So you're already in the right position. So let's just bring your feet over to the right just a little bit here. So do you take your, so typically what I say is bring your knees to one direction and then the other direction, right? And do some big movements. You want to show them? Yep. And then come on over to me. You're just kind of getting your trunk ready and your leg muscles, and again. And this can help with rolling and initiation on that. All right, now we're going to come back up, okay? I think you guys are going to go over some exercises. All right, so I'm going to come over this way. So kind of in reverse. We're going to roll to your side, over to the right side there. And then reach on over if you can with your right arm. Okay? And so I'm not pulling on her arm, but she can use my hand to pull on. I'm putting my hand behind her back and then just kind of shifting my weight. Okay? Again, like Hayden saying, going onto my heels or to shift my weight back. Okay, you want to go ahead and swing those legs over? Bring the legs over first, and then we create that pivot point. And my arm is underneath of you, and then we're just shifting up. Right? I'm just keeping myself in a squat position so I can use my leg versus my back. Okay? How you doing, Ann? Good. Yeah. Nice. All right. Can you scoot over I'm going to bring, I know I brought the mat up a little bit. Okay.
Alrighty. And can we show them some of the exercises that you do at home? So I just have a cheap $1 store inflatable ball that we use for a couple of hands exercises. We want our feet flat on the floor, our hips scooted forward. You scoot towards me a little bit in, keep your feet flat. Use your arms if you need to. flat. The one man's exercise is to take this ball from one side of the bed with her eyes on it, right? Turn your head and look at the ball. And then lift it up over the opposite shoulder and follow it with your eyes, right? Can you follow it with your eyes, Ian? Good. And then back down. You got it. Down to this side. And then up to the other shoulder. And following it with your eyes, right? You look up at it. And then back down next to this knee. So the purpose of this one is not just the shoulder strength, but also as her arms go up overhead, it forces her trunk to extend. And then her tracking it with her eyes helps to get some of the cervical extension strengthening, as well as the eye pursuit, making her eyes move to have to follow the ball. And can we go back up over this shoulder again? Following the ball with your eyes, right? Here you go. And then down. And then up again over the other. Following it with your eyes. There you go. All the way up here. Get to my hand. Good job. Back down. Do one more each side. All the way up to my hand here. Track that ball with your eyes. Keep your eyes on it. There you go. And down. And one more time, all the way up here. Follow the ball with your eyes. There you go. Good. So a little bit better cervical posture, neck posture with each one of those. A little bit better job following your eyes with each one of them, right? So she has a lot of exercises similar to that she does at home, as well as taking the ball all the way in a circle over her head, as well as picking it up off the floor and reaching it out forward. So working on that ability to sit and reach forward and then straighten up the board between your feet. Yep, as far down as you can go. And then lift it straight up over your head, as high as you can go. And look up at it. Good. Show me two more of those. As far as you can go down, and then straight up. All the way up over your head, looking up at it. Watching the ball. There you go. One more. All the way up. Very good. All right, I'll take the ball. So another good place to work on some strengthening exercises and posture exercises are actually in the corner. So Ann and I are going to walk on over to the corner now and show you a couple useful exercises over there. Move on up, Ann. You lean forward. All the way tall. Come on over here with me. One more step to your left hand. Really good. So I didn't have to say much to Ann at all. She's really good at just following, almost like dancing. And so in this position, her legs are strong. I don't have to help support her at all. She's very safe leaning backwards against the wall. And can you straighten up so that you feel your shoulders touch the corners there? Good. And from here, we can do some squats where she can lean back against the wall, keeping her back sliding up and down the wall. So she's getting that good leg strength with the wall as the reminder of where her back should be. Keeping your eyes on me, right? Up, good. And then we can do some almost like jumping jack type arm motions along the wall. So and your arms against the wall, try to slide them up as high as you can over your head. Keep them against the wall for as long as you can. And slide them back down. Couple more. All the way up. Good, back down. And one more. Good. This is also a good safe place to get some rotational exercise in. So, and you can keep your hands on me. Put them on my shoulders if you like. And keep those hips where you are. And we'll twist this way. Keep that head up. Head up. There you go. Step, step. And we'll step back this way. Big step. Big step. Good. So there, I didn't really have to keep my hands on her. She lost her balance backwards, but she's safe because of the corner. And head up again. One big step this way. We got to shift our weight forward, right? Big step this way. And big step this way. And back to the middle. Big step left. And back. Good. All right. That's about all the exercises we do in the corner, right? Yeah. Yeah. So we can show you device that Ann and I walk with a lot called the U-Step Walker, which is a type of rollator, has an increased weighted base with a reverse braking system. So has bicycle type brakes on the handles where you squeeze to go rather than squeeze to brake. This particular one has a platform attachment for those that need a little extra stability. So again, you can put both elbows in there. Yep. And then go ahead and start walking.
We use the platform when somebody has a tendency to flex forward a little bit more. You can get a little bit better control of the U-step as well.
Put the camera down.
Yeah. There you go.
It has this wide base, three rolling casters that turn on the front, so it turns in place. And then those two drive wheels in the back, which is where the brakes and the resistance are applied. And the resistance is adjustable. So it gives patients the feeling that they're pushing a sled, which can help with that force production and initiation. So with this, Ann really just kind of needs a hand on most of the time for walking. Big step in. Another thing that Ann and I do a lot is because she has so much stability walking with this, and initiation is one of the things that she needs some help with. I can actually push the walker along a little bit at a pretty decent speed, and she keeps up with it very well. So we don't have the room in here to show you that. But Ann, can we come on back? We'll have a seat on the mat.
And do you have a walking program? Do you walk with your caregivers at home on a regular basis? Because we typically, with most of our patients, you know, if we have done training, recommend a walking program on a daily basis. Help maintain all the gains we've made in therapy.
Anna's actually progressed. No, and we're not back at the table yet. Hold on a little bit longer. Stay up tall. Good. Keep that weight forward. So you feel the table behind you. Feel the table yet? There you go. And you put your hands here. Bring your hands down here. The U-step also has this really nice handle in the front that you can use for that anterior weight shift. So stand up and sit down. So very good, Ann. You need to rest for a second? Okay. So in a minute, a lot of times Ann will be able to just reach for this handle, and I will just keep a little of my weight on the front of the walker to keep it from tipping backwards. And then she's mostly able to pull herself up to standing. We can show you that in a minute. She just needs to hurt.
I'm going to move so we can see Ann. Ann, do you have anything else to add? Did we forget anything or any other pointers? That's something different that your caregivers do that you found that's been helpful?
We covered everything already.
How about getting in and out of the car? Sometimes that's a little tricky. Do you have any tricks to that? We can talk a little bit about that too. Yeah, I found. So do you have some?
You gonna say something again?
No. So I think sometimes the trickiest part about getting in and out of the car is getting the person's legs in and out. But I typically recommend swinging legs inside the vehicle one at a time. They do have a handle that you can add to the door jam that sometimes some people find is helpful, either to help give them a lift for sit to stand or to kind of give them something to hold on to that's stable to get a better lift. Exaggerating the motion of the lift is helpful as well. Some people will put something on the seat that's a little bit slicker, so it's a little easier for them to get in. You just have to be careful that they don't slide out or slide forward when you're driving. So.
You ready to stand up, Ann? All right. Reach for this handle for me. Both hands. Very good. So I'm just going to put my foot on the front of the walker and keep my hand on the handle here. Up on 3, Ann. 3. You can do it. Push. Yep. Both hands on that handle. Let go of that handle in the front a little early, didn't you? Yeah. All right. Can we sit back down again? There you go. Both hands on there before you start sitting. See how far forward that brings her. And she sits really well under control. I was not helping lower her at all with that. Let me show them one more time, in. Keep your hands on this handle until you're all the way up. All the way up. Keep them there. Keep them there. A little further forward. There we go. Now one hand at a time, right? There you go. You're always anxious to get going. You just grab the handle for right now. If you put this hand up here. Yep, there you go. And have a seat now. Reach for the handle. Very good.
Yep.
I think that's it.
That's all we have today. So I can open it up for questions.
Yes, we've got a couple of questions. Can you hear me all right?
Yes.
Okay, great. So what are some exercises that can be done with people that are not wheelchair bound?
That are not?
Or wheelchair bound or not as mobile? What are some exercises that they can do?
That are. So
Yes.
some things that okay, so again, it just depends on the mobility. But the initial one that we did while Anne was lying in bed, doing a trunk rotation, there are, I've also done some like stepping while somebody is lying on their back, like stepping forward and back, stretching legs and arms. I would recommend if they do any type, just to help maintain range of motion, touching base with an occupational therapist too. There are definitely certain handling techniques when you are stretching somebody's arm, because you want to support their shoulder in a particular way. But other exercises are neck range of motion exercises. A lot of it's range of motion and stretching, and then we look at what can they activate, and tapping into any mobility pieces. Other things that we've used are standing frames, just to help with upright posture. Standing is such a great position because it can help with respiration and digestion and skin and just overall social interaction as well. So those are some things that I've done. I don't know if you have any.
Yeah, a lot of what Stephanie was doing was the bridging that Anne needed to do to shift her hips side to side of the bed. You have a queen size bed or bigger. This is a skinnier than a twin size bed, but yeah, having them lift their hips up and trying to scoot their hips side to side, forward and backward, like Stephanie said, is great. As well as just while lying down, even without lifting their hips, trying to take big steps side to side with their feet, forwards and backwards with their feet, working on trying to get their legs up high and then stomp down with some force.
Yeah. Some other things that we've done too is I use the flat sheet a lot. So if they can't get a full bridge, I'll get that flat sheet underneath their bottom and help kind of initiate. And a lot of times we can tap into the activation of muscles. So there's definitely tricks, different tricks, just depending on the person's needs. And I feel like sometimes they are very much individualized. And it's a trial and error that I kind of find myself when I'm treating somebody, because everyone's different, and so sometimes we get pretty creative with the tools that we have.
Thank you. One person wanted you to let us know again, what is that type of walker and rollator that you have with you in the room, and what was the rationale behind it for Anne?
So it's a U-step walker. The company is called InStep Mobility. They have a couple different kinds. We have two kinds here in our therapy gym. This is the one with the platform, and it's considered a reverse brake walker, meaning that when you release the handles, it brakes. When you activate the handles, it unlocks the wheel so you can move forward. And like Hayden was saying, it helps control the position of the walker so the walker doesn't get ahead. So you can change the resistance of the wheels. I can show you. I usually recommend, when I do order one for somebody, I recommend that they bring it to me. So right there, it just needs a screwdriver, and then we adjust the. can adjust the resistance right here. But I typically recommend them bringing it into the therapy session, and we adjust it because, and then we also have to take into account if they have carpet at home, because we have thicker floors here, we may pull the resistance up way high, and then they get home and then they can't move it because we didn't accommodate for the carpet. So
the advantages to this versus a regular rollator are the stability of the base, and it is heavier. It turns with zero turn radius, meaning that you don't have to propel it forward to get it to turn because of the three casters in the front. It has a good amount of stability because of the wide base and the weight of the base, and then the resistance braking, like Stephanie mentioned. This platform version does fold up. It is more difficult to get in and out of a car because it doesn't fold up as tightly, but the regular use step that it does not have the platform attachment folds relatively flat, and it weighs 30 pounds maybe. So, it's not super light to get in and out of a car, but it is certainly doable. And it folds flat where it fits underneath most beds as well.
And I've had many people ask me, like, is there a lighter weight option? Can we get a more narrow? And unfortunately, the answer is no. The weight of the walker and the base, it serves a purpose of stability and to help control for the person using it. So,
especially with turning with a regular walker where you would have to pick it up to turn it, which can cause a backward loss of balance. This one will turn without that. And as far as acquiring one, Medicare will reimburse for it. So most of the time, actually, with patients recently, I've had faster and better success with the patients ordering it and then asking for Medicare reimbursement after the fact, rather than trying to go through an equipment company, which seems to take quite a bit longer. It can 3 to 6 months through the company. So it's $400-ish maybe for the regular, 300 to 400.
yeah.
And with the platform attachment, it adds another maybe 300-ish.
Yeah. But it's a good company, and they'll definitely work with you. Talking and collaborating with a therapist can help, because as therapists, we write letters of medical necessity that can help justify and then help obtain that order from the physician.
And USTEP is also very good. They do free 30-day trials where if it doesn't work for you, it doesn't seem like it's providing that much benefit, it doesn't cost you anything to send it back.
Excellent, excellent. Thank you so much. Another question that has come in is, recently a caregiver was walking a patient around the block with her wheelchair and walker, and the patient said her leg hurt and were cramping. What causes this? She was also out of breath quickly. Is it good or bad to take her for that amount of exercise?
Well, I guess it all depends, like, was it the first time that they've gone through that period of time? Usually when I am recommending a walking program, I usually tell patients, let's start at home, like where you have lots of chairs around so you can kind of take rest breaks. So I always start, we do a test called a 6-minute walk test. So that kind of gives us as therapists a way to help so if, the person can walk that 6 minutes, then sometimes we'll say, well, let's just start there, 6 minutes rest, 6 minutes rest. And a lot of times, if that's kind of at that person's level, then we start at home, even if they're only walking at 10 minutes or 15 minutes. It's just nice because in case something does happen, they have somewhere to sit. And unfortunately, unfortunately, the community, there's different barriers, there's different terrain, there's distractions that we have to accommodate for. So staying at home in a controlled environment sometimes is the best place, and then working with that therapist to help determine, okay, now can we venture outside and discussing what are the obstacles and the environmental obstacles outside. And the therapist, as we typically will practice those and give tricks and safety tips to caregivers and the patient. And then there's oftentimes, especially on nice days like today, Hayden and I are outside with our patients trying those and walking those longer distances, or we get them on a treadmill and we see if they can tolerate that. So it is hard to say why they're having cramping, because it also depends on if there are any other medical diagnoses. So yeah, I think consulting with a therapist is definitely important when you do start a walking program, because if you do tend to walk longer distances, you have to also to accommodate for fatigue. And when fatigue occurs, then their balance may be off, and they may need more assistance. What do you think, Anne?
Okay, great. What is the best equipment to have or to request for your loved one when they can no longer stand or walk because of their legs being too weak or frozen?
So, so they're not able to stand?
It sounds like it.
Okay. I mean, that's when you can get like a standing frame evaluation. Unfortunately, those standing frames aren't always covered by insurance, but it is an option. There are also standing transfer aids. So again, getting with a therapist and a vendor, a durable medical equipment vendor, because there's lots of different transfer aids. And some of the transfer aids you can do, they can help you assist with standing. So, and then you can use them to transfer to a bedside commode or the bed. And that's a great way to get the weight bearing, stretching, and it's a functional stretching. We find too, when you stretch out somebody's leg and weight bearing, it's usually more effective than if somebody is stretching somebody's leg for a minute, 30 seconds.
For those that are kind of on the borderline, whether they can stand well or not, my patients use the sink because it gives them a good edge to grab onto rather than a flat counter to push up on.
Yep.
And so if you park a sturdy chair or their wheelchair at the sink and then working on that pull to stand, from there, it's a safe environment where either they make it all the way up and they have something to lean on, or they end up back in the chair.
Yep. I do like the sink because it gives you something to hold on to versus just the countertop.
Thank you. What tips do you have for safely bathing someone who is becoming bedbound?
Bathing, so I mean, and I assume they're not able to access the bathroom.
I think it's becoming difficult for them.
Okay. I mean, and that's when you would probably do the sponge phase, and have multiple sheets underneath of them. So then that way, when you're finished, everything is dry. And then using that flat sheet horizontal position, so you can assist with rolling.
Making sure you have that rail.
Yeah.
You really only want to roll someone towards you unless there is a wall or a bed rail on the opposite side that would prevent them from rolling that way. And then they can also use the rail to grab and help pull themselves.
Right.
So definitely making sure you have bed rails if that's the situation.
If you're able to have a hospital bed too, that's best for the caregiver, so they can raise the bed up so they're not having to lean forward. And then and you're helping somebody with rolling, bending the knees prior to rolling is always a great way, and it makes it easier. So if you bend their knees first and then bring their knees towards the direction you're rolling towards, you have most of the body weight already going towards that direction, and it can help initiate that rolling. And then like we kind of did with Anne, you can give them like your arms a hook or the bed rail.
Making sure that you're pulling on their shoulder blade and their hip, not their elbows.
Okay. Thank you. We're out of questions, so I just want to thank you all so much for being with us today. So a big thank you to Anne as well for joining us. We really appreciate her being our demonstrator of all of these exercises. Thank you so much, Anne, and a big thank you so much to Dr. Smith. And for our viewers today, we just want to say a big thanks for joining us as well. Events like this are only available because of viewers like you, so we really appreciate all of the support given to CurePSP so we could put on these virtual events during this challenging time. As mentioned before, these presentations will be available on our YouTube channel in a couple of weeks after they are edited and refined. We also have our slide presentations currently available from the sessions for today and tomorrow if you scroll down on the page. There's also a couple of other pieces of information about future events happening. We encourage everybody to please join us again starting at 11 a.m. Eastern Time tomorrow, returning with Dr. Christoph Diaz. And thank you, Drs. Smith and Ross, and thank you again to Anne, and thank you again to all of our viewers for being with us today. Have a wonderful, wonderful afternoon.